This problem usually occurs in mothers with small kids because the mother carries the kids so many times in a day. This problem can also occur in people who use a lot of mobile phone, do a lot of texting, fast texting. Carrying the kids and texting put a lot of pressure in the tendons that move the thumb. These two tendons are Abductor Pollicis longus and Extensor Pollicis brevis. The purpose of this tendon is to bring the thumb away from the rest of the fingers. We can move the thumb and the fingers because we have a lot of muscles in the forearms. When these muscles contract, it pulls the tendon and we can move the fingers. We can close the fingers and we can open the fingers. And when we do a lot of these activities, the tendons rub against a tunnel, the first extensor compartment, and it creates inflammation or injury to the tendon, and it creates inflammation. This inflammation produces pain, and the pain is typically felt at the base of the thumb around the wrist over here. In severe cases, some people cannot even extend the thumb without experiencing a lot of pain and discomfort. This problem is called Quervain'S Tenosynovitis or mummy's thumb or texting thumb. You can do a simple test yourself at home to try to know or to see whether you have this problem. This test is called FINKELSTEIN'S test. How do we do that? First, flex your thumb in such a way, then cover with the rest of the fingers. So you got this fist, and when you push down the fist, if you experience pain in this tendon, located here, then this test is positive. Most likely you have Quervain'S Tenosynovitis. If you have this problem, there are a few simple intervention, very simple intervention that you can do yourself at home to solve this problem. Number one, this is important, is to rest. If the cause is too much texting, then stop texting. If the cause is carrying your kids so many times in a day, then you need to rest. Ask your husband to carry the kids or your parents to carry the kids. But this problem, although it is called mummy's thumb, it can also affect the father, the grandmother, and the grandfather. Okay, so it is not only affecting mummies, it can affect anybody who does the same activities. So number one is to rest. Number two, you can put on a splint, a thumb splint or Quervain'S splint. This is to ensure your thumb is rested and the tendons are rested. And number three, you can try to put ice or cold compress around the painful part. This is to reduce the inflammation. You can also buy anti-inflammatory medication from pharmacy or get it from your doctor. The next one is stretching of the tendon. Very simple, but how do we do that? Try to oppose your thumb or touch your thumb to the little finger like that. This is to stretch the tendon of the thumb. You extend, stretch again, extend, and stretch again. But try not to open your thumb so wide like that, because this is straining the tendons that are responsible for Quervain'S Tenosynovitis. So halfway, touch your little finger and bring it out halfway and touch the little finger again. Okay, so 4 simple interventions that you can do yourself at home if you have Quervain'S Tenosynovitis. Sometimes you have done this very religiously and you still have problem, then you need to see your doctor to get it checked. Sometimes you have a very stubborn Quervain'S Tenosynovitis. Sometimes the doctor may need to give injection around the painful tendon. Yeah. The injection is steroid injection. As we all know, steroid is a powerful anti-inflammatory agent. So after the injection, most of the time the inflammation will settle, the swelling will settle very significantly and very fast. Sometimes the problem can come back if we do the same activities that trigger Quervain'S Tenosynovitis in the first place. I personally can give injection maximum 2 times for the same tendon. If I give more than that, it increases the risk of tendon rupture. We don't want to do that. If despite giving 2 injections the problem persists, then the next step is surgery, Quervain release, to release the tunnel for these 2 tendons. So after the tunnel is released, the friction between the tendons and the tunnel will reduce very significantly. And the inflammation can also settle very fast after Quervain release. The surgery is a small surgery, can be done under local anesthesia, and the patient can go home on the same day. Very fast recovery, and the risk of recurrence, the problem coming back, is very, very low. I hope this information is useful to all of you. If you like this video, please give me a thumbs up and consider subscribing to my YouTube channel. I will continue to share more medical informations that are accurate, up-to-date, and trustworthy. You can share this video to your friends, and I hope to see you again in my next video. Bye-bye.